in the context of preparing for this discussion, I was reflecting on the power that information yields, and I began to research and look into how people perceive and speak of the power of information and education. And I came across several thoughts and remarks that I found compelling and I want to share with you. One of them is that information is liberating and education serves as the premise of progress in every society and in every family. It's Kofi Annan who said this. And then I also found something that said that knowledge is power. How to use the knowledge is the key to unlocking this power. And then last but not least, information is the key to adding value to young people's lives, as well as redistributing power and equalizing young people where there's an imbalance of power and there's an imbalance of privilege. And so at the heart of these statements is the almost universal acknowledgement that information, education, and knowledge progress us, they advance us, they liberate us, and they equalize us. And in many of our country contexts, regional contexts, Esther, you mentioned in our African context, this seems to be the gospel truth about information, except when we are talking about information, education, and knowledge about comprehensive sexuality. So when we're talking about comprehensive sexuality education, this doesn't seem to be the gospel truth anymore. And then it also seems to continue to be the gospel truth, except when we are talking about adolescents as the persons who should be the beneficiaries of liberation, progress, equality, and advancement in their lives, and therefore be able to make decisions that impact their sexual and reproductive health and lives. And so I'm so concerned by these exclusions because of several things. And so let me just contextualize. Estimates from the UNFPA and the WHO from 2016 to 2018, and more recently, indicate that girls aged 15 to 19 years old account for 11% of all births globally. And in sub-Saharan Africa, adolescent birth rates are amongst the highest in the world. And then girls aged between 15 and 19 years old also account for 14% of all maternal deaths globally, with about 50,000 girls dying from maternal causes each year. And then in sub-Saharan Africa, adolescent mothers account for 20% of all maternal deaths, a great number of which are due to complications, including complications from unsafe abortion. And then in addition to this, we have the burden of death, the burden of disability, and the loss of good health that is wrought by HIV, which remains significant. And as you said, Esther, the most vulnerable populations, such as out-of-school adolescent girls, mostly between the age of 10 to 19, who are very hard to reach, are most affected by all these issues that I'm highlighting. And so when I reflect upon the position and the exclusions, and then I look at these numbers, I ask myself, what am I missing? Am I missing something? Because it's entirely unclear to me how many communities and how many governments really draw the line and decide that comprehensive sexuality education, which constitutes information, education, knowledge, should not be taught and delivered to adolescents. And therefore, essentially, the progress in life, including in economies, including in politics, including the advancement in their reproductive health and lives, the liberty to decide and the equality amongst genders, equality amongst peers or with peers across the globe, all these benefits that would come from access to comprehensive sexuality education then remain inaccessible, yeah? And so looking at those numbers and reflecting on the preventable injuries, the preventable deaths, and surely the lost opportunities for adolescents to grow, to participate, and to thrive within our communities, the need for comprehensive sexuality education and information, I feel, should really not be debatable. And what do we know about how comprehensive sexuality education ought to be in order to be effective in advancing, in progressing, in liberating, and in equalizing. So at the Center for Reproductive Rights, where I work, we've been at the forefront of defining and elaborating human rights standards for access to information on sexual and reproductive health, as well as access to comprehensive sexuality education. And I also normally rely on our partners. And so Zamara and the partners who are here on this call, WARUDET has been mentioned as well. I always refer to our partners, other partners such as the International Planned Parenthood Federation, who have elaborated frameworks for rights-based comprehensive sexuality education. And so what we know is that amongst the standards is that comprehensive sexuality education must be wholesome. It must be wholesome in tending to physical and biological aspects, but also social and emotional aspects of our adolescents. It must be based on and offer accurate information. It must be evidence-based. It must be based on the realities that our adolescents are experiencing. And in that very same vein, it must dispel myths and misconceptions about sexual and reproductive services that we know, we have found, and we have documented hamper access to services. It cannot be delivered as a one-way means of communication, delivered and closed, no. It must provide room in how it's delivered for adolescent recipients to communicate back as well, to develop their skills in negotiation and decision-making, to develop assertiveness so that when they're making decisions and they're negotiating, they're doing so with courage and conviction. And last but not least, CSE must be adapted to age and stage of those to whom it's targeted. And so paying particular attention to nurturing the values that we are embracing across our societies, a respect and a responsibility for self, but also for others, and a non-judgmental attitude, because we know that there's no room for biases, there's no room for prejudices, there's no room for stereotypes that promote discrimination. And so these are some of the standards that we've been speaking about, and this is what we say that CSE must be founded on in order to be effective in liberating, in progressing, in advancing, and in equalizing. And so let me close and give way to our panelists by saying a few final things that we can reflect on. Esther, you've mentioned a little bit that a lot of opposition about CSE is based on misinformation, disproven information about the content of CSE, about the purpose of CSE, about ultimately the impact of CSE. And so today I take the opportunity to call upon our duty bearers in local and national governments who may be joining us and who we work with. Because information is power for you as well, you ought to rely on accurate information on the liberating, equalizing, progressing, and advancing power of CSE to make laws and policies that enable access to CSE for adolescents in all their diversity. You ought to do this in consultation with young people, including the most marginalized, their parents, their caregivers, and their wider community. And then I also call on parents and schools and school officials, because information and knowledge constitutes power for you as well, that you use that accurate information to be able to make decisions to ensure accurate access to CSE for all our adolescent children. And then finally, I call on us as Africans, because culture has been used to oppose the teaching and delivery of CSE, to consider, as our very own Chimamanda cites in one of her books, that we all should draw inspiration from on feminism and culture, and say that if it is indeed true that it is not in our culture to teach, to disseminate information and education that will liberate, advance, progress, and equalize our adolescents, then it's high time that we made this part of our culture. In the very same way that we've accepted as our culture and in our being the need to ensure appropriate access to digital innovations and digital spaces in our communities without discrimination. So we cannot say it enough, and it bears repeating: information and education are power for adolescents too, and comprehensive sexuality education, information and knowledge wield power for adolescents. I really hope we can take away that from, the discussions that we're having today. So thank you very much, Esther, and back to you.
Thank you very much. Really beautifully put, well put, and you've kept on reminding us that comprehensive sexuality education, access to it, will progress us, will liberate us, will equalize us. And also I heard you mention that, we should not debate about comprehensive sexuality education. We already have the data in terms of, how beneficial it is for young people, adolescent girls and boys in all their diversities. So we should not really debate on it. And the Minister of Portugal mentioned and said that, we are actually negligent if we're not working to ensure the realization of CSE. And you rightly put it like that. We need to be able to really ensure we do this work to realize CSE, because it gives the girls and boys power, to progress them, to liberate them, and to equalize them. Those are the 3 words that I'm picking from your amazing presentation. So thank you very much, Betty. I'll go back to now the panelists as they introduce themselves. I hope you all saw that one of them is coming from Kenya, the other one from Zambia, and the other one from Uganda. So I'll start with you, Chombo. Could you please be able to describe what is the status of comprehensive sexuality education for out-of-school adolescents in Zambia? And considering that, Zambia is one of the few countries in Africa that has committed to the Eastern and Southern Africa commitment on comprehensive sexuality education. And when you look a little bit back into the history of the ESSA commitment, which is, the Eastern and Southern Africa commitment on comprehensive sexuality education, when it was realized in the first time, which was 2013, at that time we had 23 countries that committed to ensure that there is comprehensive sexuality education. And in 2020, the new commitment really was done and it was also realized. But this new commitment, we've kind of seen, the laxity in some of the governments in terms of really recommitting to the CSE. But for Zambia, we've seen is one of the countries that have committed to CSE. So what is really the status of CSE for out-of-school adolescents in your country?
Thank you so much, Esther. Allow me first to start by stating that I'm one of those people that believe that a person is distinguished by how much knowledge they have. If I'm well informed in a particular subject, I will be able to articulate myself very well. And so for Zambia in 2014, allow me first to actually make acknowledgements for the great job that the Zambian government has done and still doing with other partners such as non-governmental organizations, that's UNFP, as well as UNESCO. So in 2014, the Zambian government actually developed a very ambitious framework on comprehensive sexuality education, which was then included in the curriculum, the Zambian curriculum, and targeting pupils in the grades of 5 to about grade 12. And so not only did they work on the addition of that information in the curriculum, but they also came up with a manual that would then guide the teachers on what exactly it's supposed to be taught in this particular subject. And there are quite a number of researches that have been done to get to see how much effect this curriculum has actually made, of course, with the focus of the rural areas here in Zambia and also the urban areas as well. I'll take us back a little bit in the years 2013, 2014, thereabout. The government wanted to put up a plant where they'll be able to actually make computers in, of course, with the aim to ensure that there is less cost on importation of computers. The government also came up with a plan to ensure that schools here in Zambia are actually equipped with the necessary equipment, in this case, the computers. And so there was a purchase of about 6,000 computers that were distributed in the countrywide, though the target was at 12,000 computers to be distributed in the country, which I feel was a plus. However, I must state that I'm not too sure how far that has gone, given that I wasn't able to get much information in regards to that. But when it comes to comprehensive sexuality education, the government has really done a great job, of course, with the help of its partners, that's UNFPA, UNESCO as well, to ensure that pupils actually get the information that they require in the areas of CSE. Thank you so much, Esther. That's the status for Zambia.
Thank you very much. And we keep on seeing that Zambia is one of the countries that we hope to emulate, because then, you already have, manual that was really done consultatively. And, at least there was computers that were distributed to schools. But then also the other question, which I'll come back to you, is that, is it working? Adolescents out of school and in school able to really access comprehensive sexuality education. But before you come back and speak about that, which you will tie into the issue of use of technology, allow me to go to Kenya, where we speak to Grace Ogolla. Welcome, Grace. Please let us know the status of CSE in our country, Kenya.
Thank you very much. It is true, as you put it very right, that in Kenya, we would say that we are making baby steps with regards to comprehensive sexuality education. And I just want to give a snapshot on the indicators that makes us feel that things need to be a little faster as compared to how they are right now. Because when you look at the statistics at the moment, you realize that more than a third of adolescents, that is between the age bracket of 15 to 19, have already started sexual intercourse. And this translates to about 37% and 41% of both female and males, respectively. And it goes ahead to state that about a fifth of the current adolescent to young people we have are currently very sexually active, and that is something that we cannot bury our heads and pretend that it's not happening. There is also some interesting information with regards to contraceptive use, and among adolescents, you realize that contraceptive use is relatively low among adolescent young people in Kenya. And the statistics state that it's about 41% of young people between the ages of 15 to 19 who are actively using any method of contraceptive. And this translates to the teenage pregnancies that are recorded in our country, and it is on the rise, as we are all aware from those who are taking records of what's happening. Besides that, we have to also acknowledge the fact that our government has also made some good strides in terms of just laying out policies and to make sure that implementation of CSEs, especially in school adolescents, takes place. And this is with regards to the launching of a number of policies which are in line with in-school adolescents. We look at the school health policy of the 2019, which provides for the teaching of age appropriateness in sexuality education among school going. The government has also done some provision in terms of sexual reproductive health information and services for adolescents. And this has been supported by various health and education policies. We have about 8 policies that just strengthen this since 2003 to 2015. To 2019, actually, we've had frameworks on policy on education and training. That was in 2014, 2013. We've also had education sector policy on HIV and AIDS, and the school health policy in 2019, which is currently being reviewed. That is the adolescent SRHR policy. I would also want to say that Kenya is one of the countries that signed the declarations in 2013 in which they committed in scaling up comprehensive rights-based sexuality education beginning in primary to secondary, which has not yet been, its implementation has not really taken place, because you realize that the CAC elements that we have in the country basically are targeting in school and not primary to secondary, but majorly focusing on secondary education. And something to note on these is that programs that support CAC, comprehensive sexuality education, out of school young people are basically the non-governmental organization, but not the government per se. I think that is a snapshot of my take on the status of the Kenyan CAC. Thank you very much.
Thank you. I'm saying before you go quickly, in 1 minute, you mentioned the National School Health Policy to be one of the policies. You also mentioned now the review, which is called the National Adolescent Sexual Reproductive Health Policy of 2015, that is being reviewed right now, that really has provision of comprehensive sexuality education. So how has this policy translated to access to comprehensive sexuality education in school, considering that all these policies that we have are in school? And you mentioned that it's only NGOs that are doing the work. And how can we then be able to use these policies to continue advancing CAC out of school?
Thank you very much. From my take, I think the policies have really helped in penetrating a little bit of comprehensiveness of CAC delivering in schools. At least as we speak now, access to public schools in terms of even from the non-governmental organization, even the issues that have been integrated into specific topics, they are now, you can literally pick out which subjects now have elements of CAC in the curriculum, despite the fact that they are not being examined. But you can have components of the CAC trainings or CAC information provision, which have been incorporated in specific curriculums. Like we talk about biology has components of CAC, we talk about Christian religious education has components of CAC as well. And this implementation of these policy reviews and frameworks have also made it very possible for the NGO world to just get access to the school setups and just have some trainings on the same as well.
Thank you very much. So allow me to jump over to Uganda, calls itself the Pearl of Africa, which it is the Pearl of Africa. And there we meet Brenda Akot. Please share with us, what is the status of comprehensive sexuality education in Uganda?
Thank you so much. Definitely, Uganda is the Pearl of Africa. In Uganda, we started with what is commonly known as PIASE, which is the Presidential Initiative on AIDS Strategy for communicating messages on HIV prevention, and this was mostly targeting primary schools. And UNESCO supported the government to roll out a handbook for teachers from P5 to P7, that is upper primary. So that is something that started in 2002. However, one thing that was unique about this message is the government was preaching abstinence. If you look at what the adolescents need right now, you'll realize that this policy was not preaching something that was really helpful, as we will later look at some of the challenges we have. Later in 2018, the government developed a national framework, and the framework is mostly looking at what is acceptable, to what extent can a teacher teach a child, a pupil, about sexuality education. The framework is so wide, it looks at what can be taught from lower primary, that is a child of about 3 years, to a child of 17 years. So each age group, for example, 3 to 5, maybe they'll talk about being God-fearing, how to dress up. So you find that ours is God-fearing, and it's really controlled, and the government decides on what should be said and what children can learn. However, I think Betty mentioned earlier on that there is also culture, and you'll find that if you look at how this has worked besides culture, you'll find that Also, most parents are shying away from this same information. So this leaves it to only the teachers, and this leaves out the out-of-school adolescents. With the coming of COVID in 2020, 2022, the government of Uganda also revised guidelines for the prevention and management of pregnancy in school. I believe that this also contributes to our status because we have seen a shift. We have seen pregnant girls being allowed into schools. We have seen breastfeeding girls allowed into schools. We have seen some adolescents that had dropped out of school returning to schools because of these commitments that the government has. Actually, last year, some teachers were chased away from school for chasing away a pregnant girl in some places within Uganda. And then finally, we also have our commitment as a nation to the FP 2030 commitments, and specifically the second objectives looks at increasing funding for adolescent sexual reproductive health programs. So this is an opportunity, and it's a policy that is being used by very many partners like UNFPA, WorldAid ourselves. We use this policy to advocate for more funding, to write proposals, and it has seen increase of services to adolescents on comprehensive sexuality education. Thank you.
Thank you very much, Brenda. And one thing that I've taken from your submission is the fact that the government decides what is being taught. And also you mentioned the fact that it is really more abstinence only kind of comprehensive sexuality education. So it's not really comprehensive. It is kind of sexuality education, which is more biological. And I think it's a trend that you keep on seeing in Africa and most of the African countries, that each and every time they come up with policies or guidelines. Kenya has the famous adolescent guidelines that was launched last year. And when you look at it, the first thing it says abstinence. And we're laughing at the office one day because then if you also continue reading through it, it says causes of teenage pregnancy is sexual activities. And we kept on wondering, what is sexual activities? At least you've been able to bring that out. And I'm coming back to you, Akot, before you leave. So how has the use of technology been able to advance the realization of comprehensive sexuality education? And here, let's think about also the out of school, and you mentioning how, the FP 2030 commitments that the government has committed to continues to help your organization increase funding for adolescents. And how have you been able to use technology to advance the comprehensive sexuality education?
Thank you. You see, there is an interesting fact about adolescents, and that fact is that adolescents are more interested in their privacy, and they are more interested in being autonomous. They do not want to be identified by their parents that they're receiving some of these services or they're actually sexually active. So when we talk about technology, we have very many apps that very many organizations are developing for adolescents to access services, to ask questions. We have the internet. We actually have adolescents who know how to search and delete, and you will not know what they have deleted. However, it's positive because that is what they need. At that point in their lives, they're looking at their privacy, they're looking at their ability to access some of these services and their information. So right now, if you look at technology in Uganda, you find that last year, our curriculum for education changed. And right now, children have access to mobile phones in schools. They have access to laptops. They also have access to their parents' phones, by the way. So you find that children take this opportunity, adolescents take this opportunity to get their own information, to download apps that can help them. Luckily enough, within Uganda, some of these apps have not been censored, but most of the apps are controlled by partners, especially those who have programs on health, especially those who are working with adolescents. However, this also comes with a challenge because most adolescents cannot afford the internet. They cannot afford the data to keep checking. They cannot afford to always go back. Then the big advantage that comes with this kind of access to information is I can refer another adolescent. I'll say, check out this website. I got this kind of information. You need maybe condoms. check out this app. They can actually deliver them to your doorstep. So I believe technology is a two-way street, whereby adolescents can actually gain a lot if well managed, but also it could be dangerous if not well managed.
I like what you say in terms of the fact that, yes, technology has given us opportunity to ensure that young women, girls, adolescents, and gender expansive person can actually get the information and the services, but at the same time, acknowledging that digital divide, the affordability, the accessibility of the internet itself. And I think one of the also aha moments that I've had, which, I keep on having this during this week, is the fact that we also have adolescents that can search and know how to delete, because you want to access this information from a safe source, but at the same time, you don't want people to know what it is that you're searching. So thank you very much for sharing that.